Hello, I'm Dimitri Mugianis. I'm a holistic health counselor at New York Harm Reduction Educators in East Harlem. I've also been working with psychedelics for the last 16, 17 years, and a writer and activist. Really excited about this article coming out that I co-wrote with my writing partner, Jonathan Dickinson, called why Ibogaine would not be the solution to the opioid crisis. And that might seem like a shocking title coming from myself and Jonathan. Jonathan, who's worked for years in the field of Ibogaine, and myself, who have not only been a practitioner detoxing people, but also I was saved or healed through Iboga 18 years ago from a 20-year plus IV heroin and cocaine habit. Ever since the beginning of the Ibogaine movement, since our founder, or our sort of spiritual father, Howard Lutzoff, discovered the anti-addictive aspects of Ibogaine, the whole movement has sought to put it into the context of the existing treatment modality, the existing treatment paradigm in the States, Canada, and Europe, understandably, because that held the mechanisms for delivering the medicine. But increasingly, over the years, I see what a mistake that would be. It would be a mistake, firstly, because it sort of presents the medicine in a linear context, saying that healing is a linear event as opposed to something that is unfolding, that the only true measure of healing is the cessation of drug use, when all kinds of other things happen with Iboga, even when people, which most of the people, the vast majority of the people, use drugs again. The other thing is that introducing into a for-profit system that is informed by the war on drugs, by prohibition, is dangerous because people will be forced or coerced through sales pitches to get into an Ibogaine treatment. And then the system itself is just completely broken. The treatment system in America is completely broken, much like the mental health system in America is completely broken, and the larger psychedelic movement seeks simply to insert itself in it. And the other thing is that Ibogaine is very effective at detoxing people. So folks go in and they are completely detoxed, which leaves them very susceptible to overdose. And currently, the treatment modality that is being offered in Europe and Canada in particular, and Europe is, in the United States, is folks are put on maintenance drugs like Subutex, Suboxone, buprenorphine, or methadone because the risk of overdose after a detox is very high. So there is really no demand for that. What we're calling for is not an end to Ibogaine, but to use Ibogaine and other psychedelic medicines as a tool to transform the existing systems, to re-examine what it means to heal, and not to be so linear. So Ibogaine, I'm still an advocate, but not in the way that it's being pushed and has been pushed since the beginning of the Ibogaine movement, which is to put it into this harmful system. If you're somebody who's interested in psychedelic medicines, has an addiction problem, or knows someone that's struggling with problematic drug use, I think this is an important article. Really excited by the care and the thoroughness which the staff of Chacruna has put into this piece. So really grateful, and I'm looking forward to hearing your comments.